Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. All right, John, tell me what's going on with your shoulder. What happened to your right shoulder?
There wasn't any specific injury that I can remember, but for over the last 2+ years, I've had a lot of shoulder pain and tightness and restriction in mobility, and it just keeps me from even being able to sleep at night.
How much pain from 0 to 10, and where do you feel it?
Well, the right shoulder can be up to, up to 9 on a scale of 1 to 10. At times, it's always at least like a 6, and I feel it all the way from here and sometimes into the collarbone, all the way around back here and into the scapula and the lat muscle.
Okay, and for the last 2 years, what kind of treatment have you had?
I've done physical therapy for at least 3-4 months.
Okay.
I felt a little bit of relief from that, but not much.
Okay.
And
you said 3-4 months?
Yeah.
Wow. Okay. Did you have massage, chiropractor?
I've also done massage therapy. I've probably done that longer. I thought that might address it initially, and really that gives no relief.
So, what kind of motion aggravates your symptoms? What can we do to really make you express?
Well, the daily motions that I notice most is
reaching to the
even reaching across gives me pain. Definitely
reaching backwards.
Reaching back, I can tell that I can't do it anywhere near as far.
So putting your clothes on.
And putting clothes on is definitely
so self-care over health activities. Okay, so we'll have you actually stand up now. So let's actually straight up. Bring your arm up back. How much pain from 0 to 10?
That's like a 7. Right in here is where I feel the most pain.
Okay, let's do the side and up. How much?
Interesting. That one's probably only a 6, but I feel it in lots of places.
Okay, and let's do this motion. Okay, how's that?
That's higher. That's like an 8, a 9.
Okay, I want you to turn around and both arms, let's bring it backward. We'll see the difference between left and right, reaching back, and tell me how much pain. Okay, now we're gonna go like from the back behind your bucket. Backward.
This?
Yep, how much pain now?
That's
So your right side is the one limited.
Yeah.
You have issue. How
I
much?
feel no pain on the left on this motion. On the right,
definitely the right is very limited compared to the left. We can see that.
And it's,
how much from 0 to 10?
9 on that when I do that motion.
And where do you feel it? You can turn around.
Where do I feel it? Again, kind of all through.
All through the front. Okay.
Front and back of it.
Okay, so we'll have you lie on your back, head over. So most of your limitation is going backward, and most of your pain when you reach backward, is that correct? That's the worst one, or reaching up, pain-wise?
I can't generally even dry this shoulder very good, so I don't know. But the reaching out that you didn't seem to be as bad. You're right.
Okay. But going behind your back.
Behind worse, and across here is a pain.
Okay, so those are the main ones we're gonna test. We're gonna test all of them, but we're gonna test. We're gonna use that. Okay. Is that painful? Okay. So this is very tight fascia, so I'm gonna release it. And you said you've been experiencing like crunching or like
yeah, and the
cracking sounds?
scapula. Oh yeah, I have.
You feel that? That's a scar tissue here. Just feel that knot?
Yeah.
Okay, and I will show it to you with the other tool.
The worst crunching is in the shoulder blades, but also there's some popping in the shoulder.
Mm-hmm.
I forget the motion that generates it.
Mm-hmm. You can feel a lot of scar tissue here. But you don't remember any kind of injury that caused this?
No,
anything?
the only thing I can imagine, the only thing I can imagine is the golf.
Mm-hmm. Did you have like any injury or just overuse or something?
Yeah, just overuse.
Mm-hmm.
At first, when I retired, I was playing, like 3 days in a row.
Back to back? Yeah, make sure you take a day off.
Yeah,
You know.
that's stupid.
Is that painful what I'm doing?
Yeah.
Sorry.
No, that's okay, you can do it. I
No,
can
no, no,
take
make
it.
sure everything pain-free. There's fine line between breaking scar tissue and causing the scar tissue.
Okay.
When you have open wound, do you want to rub it?
No.
That's going to inflame it more.
Gotcha.
The same thing, if you have internal inflammation, if we aggravate it or continue rubbing it, that will cause more inflammation. Okay?
So I need to know, is there
Everything
any-
should be pain-free, except
Oh.
the reassessment.
Okay.
Assessment and reassessment to measure your progress.
So I would just call it tender. That's all I would call it, not.
Yeah, if the
painful.
tenderness get irritating, like annoying, if you feel pressure, that's normal. You should feel pressure from the treatment. But if you feel ouch, that's not feel
Yeah.
enjoyable, that's you want to make sure you tell me, okay? But you feel that, that's a very thick knot.
That I don't feel the same as I did a minute ago.
Okay, it's gonna feel cold, okay? And I will show you now the scar tissue, how much they have. You have a lot. And thick scar tissue too. Okay. So you feel this grinding?
Yeah.
All of that scar tissue. So you feel, let's compare between this. Feel how, like, there's a little bit grinding, not very thick.
Right.
That's a scar tissue. Normally you should feel like really very nice and smooth, but I'm trying to find a good example. But take my word, okay?
Yes.
So that's all scar tissue. Feel that
Yeah.
grinding.
Yeah.
So normal muscle should feel like, oh, here you go. It's a good example. Here you feel how nice and smooth. There's a little bit here, but it's not much. It's not like this is just stuck. I'm not even to move the tool.
Wow.
It's just stuck here. You see? So that's
I'm surprised it's down the arm so much because that's where not the majority of the pain I feel.
So think about it this way: scar tissue. Our muscle should act like a rubber band. When it contracts and relaxes, stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contracts, really does not stretch much. So you have the biceps and triceps attached from the shoulder to the elbow. So when you have a scar tissue, it decreases, shortening the biceps and triceps. Yes, your pain could be on the elbow or the shoulder, but that's a compensation for the limitation of the range of motion. And you can hear the sound of, and we will see the map of your scar tissue, by the way. You will see redness. So with the ASTR tools, we can feel the scar tissue, visually can see it. We can hear the vibration actually from the tool. So there's several ways to detect the scar tissue with this tool. Feel that?
Mm-hmm.
So think about, you're reaching back, you need your muscle to totally stretch. If you cannot stretch, it's gonna compensate by jamming your joint. So you start to feel pain where your body compensating. Sometimes patients feel the pain where you have the issue, but other time you could feel it where you compensate for the issue. Or the third option is both. It's not too bad here, actually. Feel that?
Yeah.
Is that painful? It's okay.
The tenderness is right there when your tool hits,
But make sure it's not painful.
yeah.
But this is the biggest scar tissue
Really?
here. Well, you will feel the thickness from how much the tool is jumping over the. That's another way. Initially, I used to measure it with the centimeters, but after doing that for a while, you really can eyeball it and see, like, yes, this is like a half an inch, or this is like about an inch and a half size of scar tissue.
Okay.
So, and that's another way to, well, of course, your pain is, and your function activity is most important part of measuring your response to the treatment. But actually, we can measure the scar tissue to see how much was broken down the following session, and compare the numbers. Not too bad in here. So I will have you actually, because you said you have a lot of crunching in the back, so I will have you sit face the wall. And you said your tightness going up to your traps, yeah?
Yeah.
Let me know if that's too much, okay? How's that?
Fine. Tender but fine.
Okay. You feel how deep this tool going in?
Yeah.
Because you said you had a lot of massage and physical therapy. Do you think you're an electric engineer, okay? So do you think mechanically possible with your hand to go that deep?
No.
Your fingers too thick, that will not go that deep.
Yeah.
You know. So that's why if you don't have tools to really get to the restricted area, it's really hard to release it. You know,
Yeah.
with the hand. It's like, you know, you have a wire, you need to fix it, but you cannot reach it. How are you gonna fix it?
Yeah.
You need to have a tool to pull that wire so it's not out of reach. You know.
Absolutely.
Is that too much?
No.
Okay.
And I'm conditioned at this point with all the massage that I let them do as much pain as I can tolerate, thinking it'll get better.
Well, I disagree with the philosophy, no pain, no gain, because think about it this way. If you have a micro tear in the muscle and you keep pushing it, what do you expect?
Yeah.
Going to be major tear. Your pain is like a check engine signal in your car. You drive it and you push it, you're going to make it worse. I really don't want to drive with you in that condition. But if you stop your car and fix it, the check engine light will disappear. So God created the pain receptors for that reason. That's like your sensors that give you feedback about what's going on. You know, when you have sensors in electronics to detect whatever dysfunctions, that's exactly what happened in the body. Those sensors tell us something pushing on the sensor causing malfunction. You know. You feel the scar tissue here?
Yeah.
This is the area you were talking about, the grinding?
Yeah, yeah.
I can see, you can roll a little bit to the side. Just, yep, perfect. Here you go. Relax your shoulder. But here it's the biggest scar tissue here. I can feel. And your latissimus muscle here.
Yeah.
Sorry. Is that painful? Or
No, it's just, it is tender, but it's not painful.
Make sure it's not painful, okay? And here, that's a big one here in your trap muscle. And here your scalenes. And if I get to the SCM, you have a little bit here. You feel that bump here?
Yeah.
Okay. So that's why you hear those crunching sound. because your muscle moving over like a piece of rock, kind of. Okay. Your triceps is not too bad compared to your biceps in the front. Feel that?
Yeah.
Your biceps here.
Wow.
Your triceps is not too bad.
Interesting.
So, can you tell now how you compare between area that has a scar tissue and not have scar tissue?
Absolutely.
It's an easy one here, actually. And actually we'll do something fun, you know? Okay, so with the other hand, actually you can do this. Go back and forth and feel it. You can.
Oh, well, yeah.
You feel it?
Yeah.
Is it rocket science to use it, to feel it?
No.
Yeah.
And I just don't understand, it's really shaving it, you said right now.
Yeah, yeah.
That's amazing.
You will notice sometimes you really can shave it totally in one session. Other time you just need to do it like this. Some areas like this I have for self-treatment patient. You can do it in the front here. If you have a family member, you just do it in the back. But if it's an issue in the elbow here, you can try this area with the other hand. Like hold it like this. Just go back and forth. Is it awkward to use it?
Not really. No. Yeah.
And by the way, your other shoulder, you have issue in the other shoulder.
Yeah.
So does that cause pain in the other shoulder?
No.
Doing this?
No.
You can work in here and work on your pec muscle. This way, try it. You feel the scar tissue?
Yeah. And you said that that could get smooth after.
Yeah. Well, if you have comorbidity, it might take a few treatment. Some patients, if they don't have, well, your calcium is off a little bit. When you have high calcium, that scar tissue would be hard. It takes a few sessions.
They did
but
say
we
I had
need
some
to
calcium.
lower your calcium because too much calcium is deposited in your muscles, and that's make the scar tissue is hard, and hardening your artery. Gonna cause high cholesterol, high blood pressure. It's gonna cause a cascade of events. That's why we want to make sure to really get your calcium under control because it causes issue everywhere else.
Gotcha.
Does that make sense?
Yeah.
I will not be surprised it's gonna take you a few sessions for this because the hardening is from calcium deposit. That's why when I do nutrition analysis and functional medicine, we really look at certain lab work to make sure the body's breaking down scar tissue with certain nutrients. Let's up here. Okay. Well.
No, it's good. This is where this area
okay.
here is.
You can do it on yourself. The best part here, actually, patient comes and they do the treatment for themselves. Why do the work if they can do it?
Well, you're the expert, but yeah, that's a ton of crunching in there, and I can feel that.
So let me get it there, here in this area. But my point is, do you feel this is easy to use it on yourself?
Yes, I do.
Is it require engineering degree to really use this tool?
Well, it requires your
feedback. I have the video step by step how to use it with the model, do it on themselves.
Gotcha.
So this is the idea of just to have patient independent treating themselves at home. It's really possible to do that if you have the video to know how to do it. Okay, so let me actually clean this up. Just facing me, we're gonna do retesting now.
Oh, okay.
We're gonna do the retesting. So we're gonna do exact motions that you had issue with before. So let's thumb up and bring it back all the way. Tell me how that feel.
There's less right here, but still some.
How much from 0 to 10?
Maybe a 4 over here.
Okay.
4 or 5.
So went down to 4 or 5. Okay. Let's actually do this motion. How's that?
Still have a little there, but it is less. I would call that a 3 to 4.
Okay. So we start with like what, 7, 8 or something like that?
Yeah.
Okay, let's turn around and reach back both of them and tell me how that feel. How's that?
That is more.
Let's go on further. Where do you feel the tightness now?
still have some a little here.
You can turn around.
But also here.
So it's in the latissimus and the front. Okay, so now we're going to work a little bit on the inflammation. If it's a mild inflammation with the MagnaHale, it should take a few minutes to decrease the inflammation. So I use the MagnaHale as a way of diagnosing and also treatment at the same time. So you can have a seat here facing the wall. So no seizures or any electronics in your body?
No.
Yeah, okay. This is very strong magnet. You can pull it.
Mm-hmm.
So so if it's a mild inflammation, should be like just a few minutes. We measure this magnet. The field is like around 2 inches to 2.5 inches. When I combine both of them, I can get 5 inches deep. So really, I can penetrate your entire shoulder with those two magnets. And that's for the self-treatment program. It comes with one magnet. So patient, if they have mild inflammation, they can use it on themselves. Moderate to severe inflammation, just put it in a shirt while you're working, or like with a ease bandage, wrap it.
Right.
So we'll know after using it for a few minutes how severe is your inflammation. I usually tend to not use this initially to differentiate, are you stuck purely in the proliferation stage, or your body going back and forth between inflammation and proliferation, like here in this image. So this is the normal healing cycle. The body should go from inflammation, proliferation, maturation. But when someone has inflammation, they're usually going back and forth between inflammation and proliferation. And I have a video specifically talking about each step for the healing cycle. It's in my channel. Is it too much? How does it feel?
Feels good.
Okay, so you can relax your head, look straight. We definitely need to work on your posture, suck your stomach in. Okay, relax your shoulders. Okay. So I want you to suck your stomach in all the time, all position, be obsessed about it, okay? And you said it's here in your latissimus here, that's where you feel it?
Yeah.
Okay, couple of things. Initially, I'm gonna do it without using the magnet and see how you respond. Your pain level that you said 3 and 4. Okay? If your pain is gone, that's a mild inflammation. If it's moderate to severe, we'll just stick it here, we'll have you do the motion, because a lot of patients, when they have the magnet on,
they can do it.
They can do it. That's a sign that you need to wear it for several hours. Does that make sense?
Yeah.
Sorry. It's right in here. That's a big scar. That's a bigger scar than here.
Really?
When I look, it's very big. So that's why you're reaching. That's big scar, not really allowing your range of motion. And I, like, the ring is almost gone, but I can see it. It's actually 2 inches, more than 2 inches, the length of the scar tissue.
Wow. That makes sense for what it'll feel.
Yeah, but we're gonna run your calcium again in other labs just to make sure lower the calcium level. We'll give you a couple of things that actually can decrease your calcium level in the tissue and see how that responds. Because if your calcium high, it's gonna take a little bit longer for breaking the scar tissue, because that's a calcium deposit most of the time. When your calcium high, it's usually deposited in the soft tissue, including muscle, including your arteries. So that's why we want to make sure that it's deposited in your bone, because it should deposit in your bone, not in soft tissue. And the way to do that, I have to evaluate your K, your magnesium, your calcium, and your D, because there's a relationship between all four to deposit it in the bone. So we have to get all these labs to figure out which one is missing that actually not causing the normal effect to deposit in the bone instead of depositing in muscle. Does that make sense?
Yes. No, it does.
Okay, I will have you really drink more water. So we're gonna go up. How's that?
It's reduced.
0 to 10?
Down to 2.
You're not making faces. Did you notice that?
Yeah.
You were making faces before.
I know. It's
Okay.
just very mild.
How's that?
It's reduced also.
0 to 10?
2 to a max of a 3.
Mm-hmm. Okay, let's turn around and do the motion and tell me how that feel. Let's compare it to the other hand. How's that feel?
There's definitely less pain.
Your thumb going further up.
Yeah.
Mm-hmm.
I can feel that I can have more range of motion.
Okay.
And the other thing is, I told you before that when I do that, it lasts, the dull ache lingers.
The dull ache for 90 seconds, you said? Yeah.
Not lingering right now.
Okay, so we're going to do another experiment because you're kind of not totally mild, because if it's mild inflammation, the 2 minutes with the MagnaHeal should be enough. So you're kind of on the moderate inflammation. So we're going to do another experiment. I'm going to put the MagnaHeal where you have the inflammation and do the same range of motion and see how you feel. And you give me numbers from 0 to 10, okay? So do you see what I'm doing now? It's all process of elimination to figure out where you're stuck and working on that issue.
I think I can actually tell too in where you did the neck thing. That
Okay, so let's do the front and tell me how is the pain now when I do that.
only at the very top now.
How much and where?
It's still 2.
I'm using
at
the
very
magnet here.
top.
Okay. Where do you feel the pain?
Here.
So this is what you're gonna do at home. Like if you're gonna use a magnet, we need to know the inflammation. Let's go down and bring it up again, and tell me how's it feel now.
Yeah, that spot feels.
When I put the magnet on it.
Yeah.
So that's what you do at home to figure out where the inflammation, and that's when you, if you're gonna use a magnet, you rab it on that area. Okay? So let's do the side and tell me how that feels. Is that the spot or
Impingement.
here?
Yeah.
Okay. What about now?
Yeah.
So you have to move it around to really get to the right spot. So you have inflammation here, you have inflammation here. So usually I recommend for a patient, do it a few hours here, then rotate it here. You need to figure out the spots. And if it's another spot here while you're working in front of the computer, you have a bandage or a tight t-shirt that you can really get to those. But we have to be on anti-inflammatory diet. Okay, so let's actually turn around to the camera. So when you go back, where do you usually feel it, in the front or the back?
I usually feel it the front.
Okay, so
well, I do feel both, but
in here. Okay, how does that feel in the front?
it feels better.
It feels better. Well, am I on the right spot? You can put it in the right spot. How's that?
I don't feel much pain. I
When you have
feel
the
like I
magnet on the
still
top,
have restriction. It doesn't go as high
you
as
still
the
have
other,
some scar tissue. We need to break it down.
but
to
I
get
don't
the full
feel
range of-
pain.
So that's an indication when the inflammation goes down a little bit here, your pain decrease. But the limitation in the range of motion, that we need to shave more of the scar tissue. Okay, that's good. So you can turn around and have a seat. So you said you had like physical therapy for 3-4 months, you had massage therapy. So this is just one ASTR treatment. So tell me, what do you think about the treatment?
I definitely see improved range of motion and decrease in pain already. Yeah.
That's good. So when I had you try to use the tools on yourself, do you think that is possible for you to work on yourself at home if
Yeah.
you have the access to the video?
Yeah, I do think the tools are easy to use, and you're basically what you showed me is going by the crunches, and
Yes,
you know,
it's
I
not
can
really
definitely-
rocket science. Yeah. Awesome. Thank you.
Mhm.
Thank you. Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen.